When collecting a patient's specimens in the laboratory for the patient's healthcare provider, the phlebotomist finds guidance from A. The doctor's note. B. The insurance company, indicating the company's address. C. The day's lab schedule. D. An ordering physician's test requisition. The correct answer is D. An ordering physician's test requisition. ABG requires what special handling? A. Warming. B. Shaking. C. Icing. D. Pre-warmed tubes. The correct answer is C. Icing. The correct answer is C. Icing. When converting 3 teaspoons to metrics, you measure out A. 1 milliliter. B. 5 milliliters. C. 15 milliliters. D. 45 milliliters. The correct answer is C. Icing. The correct answer is C. 15 milliliters. 1 gallon is equivalent to liters. A. 5. B. 4. C. 1. D. 3.785. The correct answer is C. Icing. The correct answer is D. 3.785. Suppliers will provide material safety data sheets for each of the following except A. Isopropyl alcohol. B. Hazardous chemicals in products if quantities of 1% or greater, or 0.1% or greater if chemical is a carcinogen. C. Isotonic saline. D. Sodium chloride solution, 0.9%, sterile. The correct answer is C. Icing. The correct answer is A. Isopropyl alcohol. The requisition says to draw the specimen at 15:30. What time would a typical watch show in 12-hour time? A. 1:30 a.m. B. 3:30 p.m. C. 5:30 a.m. D. 7:30 p.m. The correct answer is C. Icing. The correct answer is B. 3:30 p.m. What does 2.2 pounds, lb, equal in the metric system? A. 1 kilogram. B. 44 g. C. 100 g. D. 454 kilograms. The correct answer is C. Icing. The correct answer is A. 1 kilogram. Normal adult blood volume is 70 milliliters per kilogram. You weigh 130 pounds. What is your blood volume? A. 1,300 milliliters. B. 1.3 L. C. 59 kilograms. D. 4.1 L. The correct answer is C. Icing. The correct answer is D. 4.1 L. In therapeutic blood monitoring, at what time should the trough levels be tested? A. 30 minutes before the next scheduled dose. B. 30 minutes after a dose. C. 2 hours postprandial. D. 2 hours diurnal. The correct answer is C. Icing. The correct answer is A. 30 minutes before the next scheduled dose. Effective communication skills include A. Nonverbal skills. B. Verbal skills. C. Listening skills. D. All of the above. The correct answer is C. Icing. The correct answer is D. All of the above. From the examples below, select the best strategy for communicating with a patient that you suspect faces a language barrier or may be hearing impaired. A. Communicate using jargon because it is popular and most patients find jargon is easiest to understand. B. Communicate using words along with body movements, hand gestures, facial expressions, space, and/or touch. C. Communicate by standing directly in front of the patient while slowly enunciating each spoken word. D. Communicate slowly and with greater volume while positioning yourself so that the patient may be able to read your lips. The correct answer is C. Icing. The correct answer is B. Communicate using words along with body movements, hand gestures, facial expressions, space, and/or touch. Anticipatory fear of pain, especially in children, may cause vasovagal reaction, VVR, where heart rate and blood pressure increase, resembling a fight-or-flight response. A phlebotomist might use any of the following simple distractions except A. Listening to music. B. Telling the child there's no need to be frightened of a needle. C. Telling the child to cough, the cough trick. D. Playing with a toy or viewing a video. The correct answer is C. Icing. The correct answer is B. Telling the child there's no need to be frightened of a needle. Which communication prior to getting a child's blood specimen is considered a poor technique? A. Greeting the parent and the child. B. Telling the child what he can expect. C. Telling the child that the process won't hurt. D. Working to establish rapport with the child. The correct answer is C. Icing. The correct answer is C. Telling the child that the process won't hurt. From the statements below, select an example of a phlebotomist's confirming response that can help patients experience a greater sense of control during a lab procedure. A. My schedule is tight today, so I really need to hurry. B. I really don't understand what you are saying. C. I certainly understand your feelings about that. D. I have no clue how long this may take. The correct answer is C. Icing. The correct answer is C. I certainly understand your feelings about that. Which of the following is improper telephone protocol? A. Hanging up on callers who are angry. B. Prioritizing callers, if necessary. C. Answering the phone promptly. D. Clarifying and asking if more information is needed. The correct answer is C. Icing. The correct answer is A. Hanging up on callers who are angry. Which of the following conveys the best manner when handling/working with a difficult patient? A. Threatening to tell the patient's doctor about his/her behavior. B. Speaking in a sharp manner to the patient so he will assume you are in control. C. Refusing to perform the specimen collection. D. Agreeing with the patient when possible to help him/her feel in control. The correct answer is C. Icing. The correct answer is D. Agreeing with the patient when possible to help him/her feel in control. Which of the following would not be considered negligence? A. The phlebotomist does not report significant changes in the condition of a patient. B. The phlebotomist does not obtain a specimen from a patient who is combative. C. The phlebotomist forgets to return the bed rail to its upright position. D. The phlebotomist forgets to place a needle into the sharps container. The correct answer is C. Icing. The correct answer is B. The phlebotomist does not obtain a specimen from a patient who is combative. What does primum non nocere mean? A. Satisfy the needs of your patients. B. Be kind to all patients. C. First, do no harm. D. Always use premium supplies. The correct answer is C. Icing. The correct answer is C. First, do no harm. Best practices in phlebotomy involve all of the following except A. Careless infection prevention and control practices. B. Planning ahead. C. The use of an appropriate location. D. Quality control. The correct answer is C. Icing. The correct answer is A. Careless infection prevention and control practices. A phlebotomist's primary duty is to their patients. When working as a medical laboratory professional, the NHA certifies that phlebotomists must also uphold ethical standards of duty. Choose the best response to describe the ethical standards of duty. A. A duty to be dignified and to use time management when possible. B. A duty to develop a relationship with all others that you meet. C. A duty to society, colleagues, and the profession. D. A duty to all family members and/or those responsible for patient rights. The correct answer is C. Icing. The correct answer is C. A duty to society, colleagues, and the profession.